Okay, all set. 8:15, so I'll call this meeting order. This meeting and all other meetings of this committee are open to the public. Proper notice has been posted and given to the media in accordance with Wisconsin statutes, so the citizenry may be aware of the time, place, and agenda of this meeting. Roll call shows us all here. Need a motion to approve today's agenda.
Second.
We have a motion and a second. All in favor say aye.
Aye.
Those opposed? Passes. We need a, well, I hope everybody's reviewed the minutes from our previous meeting. I need a motion to approve those.
Motion to approve the minutes.
We have a motion and a second. All in favor say aye.
Aye.
Those opposed? Look like there's any public here for comment. Jed, have you gotten anything in emails or anything that? No. From the public? No program presentation today, so we'll jump right into the general board business.
So today we're gonna present to you our 2024 annual report. Share that on.
I know. Yeah, I'm seeing. That's okay. Sideways would only happen.
All right. So just a few notes on the annual report. You know, I think a lot of organizations do an annual report. It's just standard business practice, but we actually are also have some requirements to do an annual report. DHS Administrative Code DHS 140 requires us to provide an annual report, and then requires us to present an annual report to our Board of Health. So when we complete this, and if everybody's supportive of the report that we're presenting, we'll be forwarding a copy of that to the State Department of Health Services as well. So with that, I'll kind of get started. Oh, the other thing I just kind of want to mention, as you kind of look through this, Haley's here. She did a tremendous amount of work collecting all the data as our epidemiologist and putting everything together and formatting this report. So make sure we give a lot of credit to Haley and all the awesome work she does. I think we go back and forth with a lot of edits, and you know, it's a pretty big task to put it all together and kind of go back and forth and kind of get to a finalized product. So I think we've really got a nice looking report, and a report that provides information that, you know, we need to provide to you all and to the public. So with that, we'll get started. Just kind of go through the first couple pages. We have our table of contents. The introduction, I've got a letter here just introducing the report, and a couple things I've noted in the introduction is just kind of what I've mentioned. This is a requirement, and there's some requirements for, you know, the content that we include in our annual report, and how we've organized the annual report, and how we've organized kind of our website and a lot of other things on how the actual department functions is through the Public Health Foundational Services, which is put together through FAB, which is the Public Health Accreditation Board. So there is an accreditation board for health departments, and they have a structured organizations that they lay out for services that a local public health department should provide, along with some foundational capabilities. And so that's how you're going to see the layout of this report, is through those foundational public health services. And that includes access and linkage to clinical care, communicable disease control, chronic disease and injury prevention, environmental health services, and maternal, child, and family health. So as we're going through this, you'll know that we kind of categorize the information provided through those foundational services. The other note that I put on here is just, I think I wanted to make note that we had quite a few special projects that we'll have kind of in the next few pages. And, we had some really great performances by our staff this last year. And then I also just put a note here, just to thank you to you guys, to our Board of Health. A lot of different challenges and opportunities in 2024. And I think our Board of Health has really been supportive and great providing leadership for the health department. And on page 2, we've got a awesome picture of the Board of Health. And just a note that the purpose of the Board of Health is to serve as our governing body and is to advocate for the provision of reasonable and necessary public health services. Go to page 3 and 4. So before we get into some of the foundational services, these all fit into foundational services, but some highlights I think were a little bit unique and special for in the last year in 2024. First is just to highlight one of our staff members, Christina Ingerwell is our WIC project director, and she was awarded the WIC Everyday Hero Award, which recognizes leadership in the WIC program in the state and each region. I think there's 5 regions in the state. She was selected as our Northeast Region Everyday Hero Award. So she does an unbelievable job for our WIC program. She's kind of recognized in the state too. I think a lot of other counties look to her and look for mentorship when they're going through changes or have some questions. She's been on some of the WIC association boards. So she's really become a leader, and we're pretty happy that she's working with us. The next highlight is a well water project. We talked about this in one of our meetings. This was a special project that we worked with Land and Water. We conducted we ran over 824 water samples for a project with Land and Water, and that was kind of doing some town-based testing, but it was actually throughout the county for bacteria and nitrate. So got a lot of testing done. All those residents that participated got free water tests and got some valuable information on their well water. And it helped Land and Water kind of get a lay of the land too, as far as what we have for water quality that we're getting from well waters across the county. The next one is a mental health and substance use resource guide. We talked about that and presented that here as well. Again, this came out of one of our fatality reviews as something as a want from our first responders, a resource for them to be able to provide maybe when they're on scene or when they've talked to someone and they're not, they don't want to leave people without some sort of information, some place to go. And so we also call these squad kits because every squad in the sheriff's department and all the municipal police departments have these in their squads. So they have these resource guides to provide to anybody, anytime. And it's also been distributed to several other community partners. It's available on our website, but it's a really extensive resource guide for mental health, substance use, all the clinics and care providers in the county and neighboring counties. It's really been popular, and I think it's, we've been recognized a few times on being able to put this together from other agencies and from the state. So really a great project that we were able to put together this last year. Another project we wanted to highlight was the Mother Infant Therapy Group. We had Gretchen present on that. I think that was last meeting. I think a really successful project. Is a great partnership with UW-Madison. It was a grant provided project, and we have a little bit more details on some of the outcomes, but Gretchen kind of went through some of the preliminary outcomes of that project at our last meeting. Also highlighted our renovations. if, I think most of you have come by and they'll see our renovations. I know staff and I are really happy and thankful for the renovations, you know, getting our offices updated. And then the two big projects we've talked about throughout that were really important to us was, you know, expanding and enhancing our water quality lab, and then having that reception lobby, a secure reception lobby area. I think everybody's been really happy with the setup and the arrangement of the renovations. They've really gone well, and we're thankful for those. And the last project we highlighted from 2024 were the vending machines. So we got a $50,000 grant. We were able to purchase 2 vending machines. The grant was through the state's opioid settlement funds. We have one of the machines on the first floor in the courthouse, and we have another machine out at Compassionate Connections in Clintonville. So far, so good. I think we've really been vending quite a bit. And I don't know, Haley, do you have any quick stats for us on where we're at?
483 as of this Monday, since
480
January 13th.
483 items vended, so that's pretty good. We've had to, I think, reload a few of them a couple times. So, you know, Narcan's been, you know, the kind of the major product in that, but we've had other public health items in there that have been popular: COVID tests, first aid kits, and a handful of others. Gun locks are in there, so those have all been going really well.
Kit started, because I know
Yeah.
this came out in a month ago.
Oh yeah, those have been really popular this month so far.
Yeah.
Right.
All right. So the next page, page 5, just some notes on our administrative notes. We've got some of our budget totals and revenues and expenses provided here. And just a quick note on, I mentioned in the packet that I'd talk briefly about a 2024 budget performance. So we had an amended budget, and it was amended because we added the ARPA funds that we had spent this year, which went to our renovations. So our amended expense budget was 1.8+ million expenses and revenue of just under 950,000. And our expenses for the year were, or I should say our revenues for the year were actually 26% higher than what we had budgeted, and our expenses were 10% higher. In total, we ended up coming in under budget for what we budgeted for revenue by, it was actually quite a bit, by 67,000. So definitely performing within the budget, and actually came in under budget on that. So just wanted to add those notes. All right, next page, page 6. This is where we start kind of going through some of the foundational services. And we start with access and linkage with clinical care. A couple notes I just wanted to mention on this is, you know, we do still provide some direct care, but we also provide a lot of referral care. Some of the direct care that we do provide are vaccinations. And we've got some data on the amount of vaccinations we provided this last year. Total 341 vaccinations, and that includes children and adults. Most of the vaccinations are children. That's through our BFC program. For the adults, we also have an adult program. A lot of those we were able to provide at the jail. Reproductive health, another direct service that we provide. We've seen a little bit of a decline since last year in clients. You know, we offer a handful of services, STI testing, contraceptive care, pregnancy testing. So we do have some direct services still with that. We receive a grant from the state to provide that program. One thing also on this page I want to highlight too is that we obviously have our offices here in our clinics here at the, I shouldn't say here, but at the courthouse. But we've been making an effort really to also go out into the community and be a little bit more accessible. So I mentioned Compassionate Connections. We're also there monthly to provide services where we can provide some of our clinical care, we can provide immunizations in Clintonville at that offsite clinic. We also go to core behavioral health here in Waupaca. We are out at Marion Public Library. WIC is out at the Marion Public Library monthly, and WIC is also at New London monthly for a clinic. And we also provide some services at Project Thistle. Next is communicable disease. This, communicable disease control is a mandated service. It's also one of our biggest services that we provide. We've got a graph here, basically highlighting the four categories, the top four categories that we work with communicable diseases. These are all reportable diseases that we had to provide some follow-up with. We had 712 total in 2024. So the nurses work through those. They come into our WEDS, our system for managing those. They'll stage them, and then they'll, if there's an investigation or some services we need to provide with each disease, that our public health nurses follow up with that. So respiratory illness were the #1 category of communicable diseases that we had in 2024. This typically year by year, these are the top 4 categories for us: respiratory illnesses, GI, STIs, and then tick-borne illnesses. I also want to kind of highlight some on the quick stats. So I mentioned we responded to 712 communicable disease. We also had 39 outbreaks. So our public health nurses help coordinate any outbreak situations. The majority of those outbreaks are usually associated with long-term care facilities. All right. And that's kind of highlighted on the next page is our outbreak surveillance. And you can see, again, for outbreaks, the majority of respiratory diseases. We do have some GI outbreaks. And again, the majority of those typically are associated with long-term care facilities. We occasionally, we do have outbreaks in other facilities or out in the public. And so those are also part of the outbreak surveillance. We've also highlighted tick bite preventions on this page. So we do have a high incident rate compared to within the state, which the state is usually a little bit higher than other comparable states. It's usually the Midwest and then the Northeast that really have tick-borne illness, this disease pretty prevalent. One nice trend though is that we've seen, as highlighted in here, is we have seen a general reduction in tick-borne illness cases. So from 2021 to down to 2024. So we're hoping that trend continues, and we're trying to continue to do a lot of communication on just awareness. I think our physicians in the state are really good now of helping to identify, when to test and check for tick-borne illnesses. And then we're doing other things like the tick prevention kits. We're trying to really do our best to promote awareness of tick prevention. We've also partnered with some other entities. One of the universities is doing some tick-borne surveillance, and we've tried to promote some of that where people can send in any tick that they find, and the organization, I forget which organization is doing it, is testing every tick to see if they can, determine the incidence of what the percentage of ticks that are actually carrying disease. So there's several activities going on across the state, and we're really trying to do what we can to help prevent tick-borne illnesses.
Yeah, just a question on the high one in 21 correlation to being during COVID, just more people outdoors.
It could be.
It's just weird how it's.
Yeah, I think a lot of people got outdoors during COVID, and that certainly could be a correlation. All right, chronic disease and injury prevention. So a couple of programs that we have in chronic disease and injury prevention include our child passenger safety. And one thing we've highlighted here is just the amount of car seat distribution and inspections that we've performed. It's really trended up the last 3 years. You know, there's a newer program, I think, starting in around, actually kind of got it going during COVID, during 2020, 2021. But we've really seen a high distribution rate the last few years, and just a lot of requests for car seats. We do get a grant from DOT to provide car seats to eligible individuals. So we're pretty fortunate to be able to do that. You can see that, you know, we've distributed quite a few. We just found out, and I'll talk a little bit more about this a little bit later on the agenda too, but the grant that we get from DOT has been reduced to, and we kind of lost almost half. We just got word of that, so that's kind of, you know, a tough pill to take, because this is something we get calls for almost on a daily basis. Sometimes we even have hospitals call saying, you know, they have a newborn and they don't have a car seat and can't leave the hospital until they have one. So we try to do our best to make sure that we have the car seats available, and we have trained professionals to help people install car seats properly. But that's definitely something that is really been in high demand lately. So we also have a little bit of information on safe sleep, and just, you know, we distribute pack and plays when we have grant funding for that. Page 10, we've highlighted some of our harm reduction work, and there again, we've talked about kind of trends. You can see the year-over-year distribution of some of our harm reduction materials, including naloxone, gun locks, and fentanyl test strips. And I think with the vending machines, we'll probably hopefully continue to see, you know, more distribution going on for that. But we also have a highlight here of the UW Oshkosh nursing students did an aggregate project, expand Narcan. The project was, I think, working with some gas stations and getting them Narcan, having Narcan available at a lot of convenience stores in the county. Some information also is provided on our fatality reviews. I think a couple things that are highlighted here is just, you know, the participation from our community partners is really great, and I think that's really important for these. So we have, you know, we included some information on 27 different agencies participate in our fatality review teams, 40 team members across the fatality review teams, and those teams have provided 30 recommendations from reviews. So a lot of good stuff coming out of those review teams. Next is environmental health. And some of the data provided here is just kind of the numbers. So annual number of licensed facilities, you can see the trend there from 2021 to 2024. We continue to license more and more folks, and that includes retail food, lodging, swimming pools, manufactured home parks, body art, and then rec ed camps and other campgrounds. I think the trend of something pushing trends is, I think Waupaca, you know, although I think our population has kind of been steady, we have been having more businesses available, and I think that's obviously a positive trend for us. You know, we've talked about this before. The popularity of tourist rooming houses is definitely, you know, impacted the trend of the number of licenses that we issue. You can see too that just the percentage of, on the right side, the percentages of the type of licenses. Majority are food establishments, but followed by lodging and swimming pools, and then manufactured homes. Campgrounds are also included in that. On the bottom of the page, we had some information on our inspections. So our environmental health team conducted over 700, or a total of 730 inspections. Majority of those are routine inspections. So our inspections are, when we issue a license, it's required obviously to provide an inspection to those facilities. Most of those are unannounced. You know, you go to a restaurant or a campground, we're going to show up unannounced and just look for compliance. Every license holder, every type of license has a different code for compliance, and so we're just verifying that facilities are operating within the the state law of within those codes. We do provide pre-inspection, so before we issue a license, we do a pre-inspection to make sure that they're compliant with what's required for a license. And then on the right side of that, you can see the type of, the most common, this is just for food safety violations, leading with date marking. Every facility has to have a cleanup procedure, so that's something we've cited quite a few times. Proper sanitizer concentration and then cold holding is also one of the more common violations.
And just to make a quick comment, we have this really wonderful software called Visme to make this. So you lose it in the printed version, but on the online version, you'll see these kind of blue dots, and those are called hotspots. So you can actually click on them to get more information. So like if you're like, what is date marking? You can click on that hotspot and it's gonna pull up a definition for you. So making it a little more interactive, or if some of the graphs are hard to read, people can actually hover over all of them and be like, oh, it's 6% for campgrounds, and not have to eyeball those things. So you lose it in the printed version, but there are additional there's additional information embedded in the online version.
Hyperlinks here and there, right?
Yes,
Yeah.
yep.
All right, on page 12, we're highlighting some of our drinking water program and activities. So in 2024, our lab sampled and processed over 1,600 total samples. And that's the most our lab has ever processed. Now, a big chunk of that was part of the project I mentioned with Land and Water, but we're also just seeing more folks bring in samples from their own wells, and then the amount of facilities that we also are contracted to work with through the DNR has increased as well. Majority of testing continues to be bacteria. Nitrate's also a popular test for anybody bringing in samples. For our public water systems, we analyzed over almost 500 water samples, and that includes just routine and compliance testing. We performed 182 water system inspections, and then we had a handful of corrective actions for 11 different public water systems. And it's pretty much split between bacteria and nitrate on the type of violations that we'll see. Environmental health hazards. So again, a requirement within the state statutes, also part of the Public Health Foundational Services. So in 2024, we had 32 environmental health complaints. Those could consist of air complaints, water, drinking water or surface water, pest complaints, and then sanitary complaints, basically living condition type of complaints. So it's usually pretty steady year on year on the type of the number of complaints we get. A lot of, I mentioned kind of the main ones, but there's always a variety of other types of complaints that our staff respond to, and they really have to have a wide range of knowledge on being able to respond to a lot of the environmental health complaints that we receive in a year. Also a highlight here on radon. We do provide radon test kits. One thing I want to note is you'll see it below the graphic is that 53% of the homes tested in Waupaca County have radon levels higher than the health standard of 4 picocuries per liter. So radon is certainly something that we see in Waupaca County, something we see in the state, and I think something that we always have promoted, radon testing and data. I think that's something going forward we're really going to put a little bit more, I think, work into, because I don't know if everybody knows about radon or thinks about it, but it's something I think we really need to let homeowners know about and work to get more testing done, because it's certainly an issue. And radon is considered a carcinogen. It's the second leading cause of lung cancer. So it's something we definitely want to make sure we can help promote. Going on, we have some information on childhood lead poisoning prevention. So we had 26 new cases of lead poisoning this last year. We respond to every case that's above 3.5. We're required to do an environmental health inspection, home inspection of any cases that are 20 or above. But we provide information and education for any new case that has some elevated lead levels. So we had 26 of those last year, and then we had 2 cases that were elevated to the home investigation that also included orders on remediation for lead in those homes. All right, maternal child health and family health. So our WIC, Women, Infants, Children program, is a big part of our maternal child and family health. And the first graphic you can see on the left there are participants. Again, that's a growing trend in participants from 2022 to 2024. We continue basically to set records with the amount of participants we have in WIC, which is great. I think a big part of that is we're really good at letting people know if you're eligible and getting the word out of the program and making referrals to the program. You know, you might also kind of think too, well, we have a lot of people in WIC that are eligible for WIC. Maybe that's, you know, that's not all necessarily the best thing in the world either. But I think it's more of us being able to really make sure that people that are eligible know about the program and get into the program. And I think what's we have some corresponding data too with just how much benefits that we've been able to provide in Waupaca County. And when you think about the benefits, you know, it's being able to buy WIC approved food, which is only healthy food. And so I think that's a really big part of the program and a really positive piece of our WIC program. And then we have some information on the right side of Waupaca WIC infants versus the WIC infants statistics. So at birth, this is for breastfeeding incidents. We're a little bit below the state rate, but at 12 months, we're a little bit above the state rate. So I think just our team does a really good job of promoting breastfeeding for infants. Page 15. Fit Families is, I think, one of our really important programs. You know, it fits under maternal child health, but also I think a big piece of chronic disease. And we have these 3 boxes here for goals for families that are part of Fit Families. If you remember, we had a Fit Families presentation here too a meeting or 2 ago where Sarah Delphos was here. She coordinates that. And I think the things that are really important to see here is not only the amount of participants that we have. So we have 49 parents receiving coaching, 57 children participated in the program. We had 268 contacts delivered by the Fit Families. But you can see the difference the program has made in relation to at enrollment to after graduation. So if you look at I think the first goal 1, you know, children eating 2+ servings of fruits and veggies most days of every day. 77% said that at enrollment they were doing that. After they graduated from the program, it was 93%. And you can see those statistics going down for each goal. Every one is a positive change after participants have started the program and finished. So even if you look at goal 3, you know, you can go down to the last one, children watching 2 hours or less of screen time per day. That was a 40% improvement on that particular goal. All right, Healthy Beginnings. Healthy Beginnings is our parent education program, our home visitation program. Here again, the trend for the last several years is, you know, we're having more client contacts, we're providing more client hours, and we're getting more referrals for our home visitation program. A couple of the quick stats is that in 2024, we had 80 total clients served. 30 of those were new enrollments. 6 of our clients graduated, and 43 families were referred to additional supportive services. Then we also have some information. We do a survey, and you know, just to get some feedback And I think you can see just how successful and how popular and how well our program has done with the feedback that we get from families. Moving on to page 17. Information on Help Me Grow. Help Me Grow is a model system that assists parents and caregivers in receiving the best help and resources for child development. We do screenings, the ASQ screenings through Help Me Grow. And this last year, we had 221 children participated in the program, and we provided 188 ages and stages questionnaire screenings through the Help Me Grow program, which is, I think you probably don't see those type of numbers in too many other counties. We're really doing a great job of getting those screenings and helping people and helping families, get their children set up and ready to start schools. We also have a little bit more information on the MITG project we talked about earlier. Gretchen was here and provided information on that at one of our previous meetings. And we just have some preliminary data on that program, but we're finding that participants reported a decrease in depressive symptoms and an increase in feelings of connected with the baby after going through the program. And as Gretchen mentioned, we'll have some more information on that as the research on that project continues. Prenatal care coordination. So this is a program where we get referrals primarily from healthcare providers. Anytime they have an expectant mother, they think they could maybe use some extra education or resources or support, we'll get a referral from healthcare providers. So those have actually trended down in the last year with client contact hours. I can tell you already in 2025, I think we've gotten quite a few more referrals. And I think maybe potentially with the changes that Theta Care has made to their labor and delivery, we may see a little bit more support our way in those things. And I've let them know too that that's something that we have, and we definitely want to support them and promote this program more. We also get postpartum support. Again, those are referrals from our hospitals and clinics to provide some postpartum support to families as well. And so those are our foundational service areas and information from 2024 and on our programs that fall into those. And we have our additional areas and capabilities. Communication is one of those. And so in 2024, we triaged over 1,200 phone calls that just came into our main line. We do get a lot of calls like directly to our program staff, but 1,200 phone calls. And right now, Lisa's doing a really good job of categorizing all the calls that we get in, all the walk-ins we get in. So next year we'll have a little bit more detailed information on just I think that helps us kind of gauge what people are looking for from us and the type of services that they're looking for from us. We also posted 183 times on Facebook. Again, that's education, getting information out. A lot of it's data, a lot of it's if there's events that are public health related going on. We're posting and trying to communicate through social media. We also do some community partnership development, a lot of coalition work that we're a part of, and we also do some social group events that our Fit Families and our Healthy Beginnings host, and those have been really great. And we have a statistic on the bottom of page 19 of just the amount of participants that have been able to come to those and get some education and some resources. So those continue to be really good services, I would say. And then page 20, emergency preparedness. That's a requirement in state statute and a foundational capability. And so every year our staff are taking training and doing exercises. And then, it's all being prepared for events. One of the events that we actually then did respond to was the Manoa flooding last year. We were able to provide support at the shelters. And then we also did some drinking water testing during the flooding to make sure, we didn't have contaminated wells around the flooding, and the city water wasn't contaminated from the flooding. We also did some mass vaccination clinics. That's an exercise that we've done throughout the years to provide for, or to prepare for any time, if we have a pandemic or epidemic that requires some mass vaccinations. So we did, we worked with the school district Waupaca and provided flu vaccinations as an exercise for us to prepare for mass vaccinations. And I think that takes us to the end. So with that, we'll take any questions or any comments or any thoughts.
Job putting it together.
Yeah, thank you.
Was thinking a little bit about the some funding for the car seat program, but with Theta Care, with the birthing part, those numbers are probably gonna go down anyway, so it might be okay for us.
Well, I don't know. That'll be interesting to see. I think even though without having, births here in the county, I think people are still having children. The actual where they're having them is gonna obviously be out of county, but there's a lot of families who just are not prepared for what they need.
But like you said, the hospital would call a lot of times, sending home an infant without a seat.
The residency matters, so
Okay,
because I used to work in WIC and I used to refer families, so WIC is one of those firms where you can have people from out of our county, maybe in New London, who are across the line. But
okay,
if they're in Outagamie County, they have because of the
Yes.
program, they have to get a car seat from Outagamie
from
County.
that town.
If they are a Waupaca resident, Outagamie County or Winnebago County can't give them a car seat. It still has to come from us. They still have to meet the qualifications of, I think it's Badger Care or some sort of income guidelines, but the residency does matter for that program.
Yeah, I think we'll probably still have, it'll still be pretty popular. A pretty big need.
I have a question.
Oh, go ahead.
Like in terms of radon testing, that's not required that people do mitigation if their levels are too high, is it?
Nope.
But is it recommended
Yes.
when they get their results back? But then it's on them to get it done. Okay.
So when any test kit that we provide, we get a copy of the result, and if it's above 4, we send a letter with information and resources. But yeah, it's on them. It's your own home.
Are most people doing it just when they're buying a house or also any random time?
A lot of people do it when they buy, and a lot of times, during a real estate transaction, that's something they can check off. Do you want home inspection included with a radon test? And that's a good time to do it. But some people might waive that, especially depending on the market and how fast they want to try to get in home. But really, it's something that you should always get that baseline. If you move into a new home, you don't have a baseline idea of where your rates are at, or radon's at. It's something that should definitely be looked into.
Right, and it's a misnomer that I've heard people say, well, we don't hang out in the basement, and my husband and I are like, that doesn't matter.
Yeah, a lot of times the concentration might be higher there, but it can still work its way up to the next levels.
Just to spin off on that, you're talking about more dissemination of information on it. Could there possibly be a link with regard to your website that talks about to hotspots within the county?
We actually have an interactive map on
You
the
do?
website. Yeah.
Okay, because I take it for granted too. I should be checking into it.
And mitigation it's usually not that expensive, and it's relatively inexpensive. It's basically you're funneling. They'll make a hole basically in your basement and make a chimney basically out of PVC with a fan inside of it to basically push it out and around your house.
And the more airtight people make their house, the worse it gets, the radon, because it just accumulates. So it's just a matter of giving it a easier route to leave. So it's, yeah, it's a really inexpensive fix.
Right, we put one in, like the day we moved into a house out by Hartman's, in through like a closet, but then at our current house in town, ours is outside. It's kind of ugly, but it doesn't matter.
Or you can have really drafty windows in your basement like I have.
Problem solving.
Do we need a motion to approve this for you to send it on?
It's not required, but I think we've done that before, and I think it's helpful to approve that. To approve
Make
it.
that motion. to approve This.
I'll second it.
We have a motion and a second. All in favor, say aye.
Aye.
Those opposed? Okay. And that along to whoever needs to see it, Jed.
Thank you.
Brings us up to personnel.
All right. Personnel, so we had a new staff start this week. Kira, one of our, as a public health nurse, started this week. And on Monday, we'll have a new environmental health specialist start, Jessica. And so we have almost all our vacancies filled. We just have one left that we'll be interviewing for soon, and that's our part-time limited term public health position. That's all I have.
General update.
So just a few things on general update. One is today is Administrative Professionals Day, and just wanted to highlight, we have Lisa here. Lisa started with us a few months ago, and she has been absolutely awesome. Everybody has been really providing some great feedback and loves working with Lisa. She's been doing an awesome job managing our offices, working with clients. We are so thankful for Lisa. You know, everything that's here and ready for you guys at our meetings, Lisa's doing that. So just want a little shout out to Lisa for all the work she's done.
Thank you.
Thank you. We should have brought you coffee today.
And the other thing I was gonna mention, which I touched on, is, you know, we are starting to see a little bit of information come our way on some of our grants that are pass-through grants from the federal government. I mentioned the car seat one. I got a little bit of information that we may be having our immunization grant cut as well. And potentially there may be some of the more grants that we see that we basically have in our budget that we've had for years in our consolidated contract. We might start seeing some changes though. So, you know, so I'm a little concerned of, you know, the impacts that might have for us, but just want to kind of put that out there that I know for sure we've heard a little bit that, you know, 2 of those grants might be impacted and there could be more. So we'll see where things go. But if you looked at our budget too, you know, we still provide our revenue. Over half of it is from grant funding. So that definitely can impact some of the things that we do here.
So are there strategies that we're looking into, like maybe tapping some of the auto dealers around here for money to help us with the car seat program? Or,
you know, that might be something we have to look into. Can we get some for that, you know, for something that specifically too? Because can we look at maybe donation style for programs like that? Is that something we have to look into? I think we're gonna have to have probably some of those conversations.
Do they have to be new car seats or can they be slightly used or?
They have to be new. And that's all I had for updates.
supervisor reports, anybody go to anything or want to touch base on anything? Great, next meeting, May 28th. Probably be here again. And with that, looking for a motion to adjourn.
So
On debate.